The foundation of individual therapy is the helping relationship. In any kind of therapy, in order for growth and change to occur, a patient needs to have insight, and we need to promote growth and change. In individual therapy in specific, the client needs to feel empathic understanding, genuineness, respect, compassion, concreteness. All those things need to be conveyed by the therapist, but most importantly perceived by the client in order for therapy to be effective. Oftentimes, a client will reveal something first in individual therapy, and then with the therapist, he or she feels more validated. We help normalize what's going on. We cut through the fear, the insecurity, the shame, the guilt, the anger over an issue, and then they can take that kind of newfound insight into a group session and risk revealing it to a group of their peers. Sessions range. They can range anywhere from 45 minutes to an hour, and sometimes even beyond that. If a client is really struggling, we try and build into our schedule that we have more time to spend to them. And each client is entitled to a minimum of 1 individual session per week, but there is no maximum limit. We don't assign individual therapists at the Beachcomber. The Beachcomber philosophy is that each therapist knows all about each client, their presenting issues and their history, so we really promote that the client chooses the therapist or therapists that they feel comfortable with or that they connect to. You know, establishing trust in any relationship just doesn't come automatically. So one of the first stumbling blocks to overcome in individual therapy is establishing that safe, trusting environment so that the client feels they can open up. You know, they entrust us with their innermost feelings and thoughts, so they need to feel like there is a safe environment for them to continue, or else they won't want to be in individual therapy. So that's the first stumbling block. After that, fear, anxiety, resistance are always stumbling blocks that can occur really anytime throughout the counseling process. And we don't look at those as resistance to therapy, but we know at that point that there's some stumbling block or issue in the therapeutic alliance and that needs to be nurtured or understood better, and so we work through that. We want them to build strengths and resiliencies, and we can really work through that in individual therapy. That really is the basis of our helping relationship.